many of you may or may not know, by training, I'm an obstetrician, maternal fetal medicine specialist. So births are very important to us. And this, to me, is giving birth to a very long pregnancy. Well, you know, my colleague, my partner, Bob Krenzik, and I have coined a term that we've used very, very often, and it's called the power of partnership. Well, today, and our groundbreaking ceremony today marks what I think is a tremendous demonstration of the power of partnership. A partnership that really exists not only between the medical school and the medical system, which we call the University of Maryland Medicine, but also a partnership that exists and has been brought together by so many constituencies. The University of Maryland, Baltimore, College Park, the University of Maryland, University System of Maryland, local communities, federal, state agencies. This has been an extraordinary constellation of groups and agencies that have come together to have made today possible. So I certainly want to recognize what, in fact, the power of partnership can actually accomplish. Today we have realized our shared vision to be able to bring discovery-based medicine to Prince George's County, and in particular, the University of Maryland Capital Region Medical Center. It has been our tradition where we provide on a regular daily basis innovation and clinical excellence, and that we expect will continue to make its mark here in this region. Our presence here is really a strong indication of our commitment and our contributions to the Prince George's County and the neighboring capital region. As you know, the University of Maryland Medicine, the School of Medicine, and the medical system combined has a stellar national reputation for healthcare excellence, and specifically with regard to diagnoses and treatment of complex diseases. I'm confident that with our presence in this region, healthcare excellence will become evident and become widespread in Prince George's County. Many of our highly successful clinical destination programs will be here. Some are already here, but more will be moving in town. First, let me give you a glimpse. Let's talk about our cardiac services program, which is highly rated nationally among the best in the nation. We offer and will offer here extensive range of cardiac surgical services, repairing congenital heart defects in infants and children, performing heart transplants, and also several other complex procedures for high-risk adults. Second, our cancer treatment program. That will become available here through our Marlene and Stuart Greenebaum comprehensive cancer centers. Now, I should mention parenthetically that there are only 48 comprehensive cancer centers nationwide that has been designated by the National Cancer Institutes. What does this designation mean? It means that it signifies the highest level of discovery-based medicine and care that's available throughout the nation. University of Maryland is one of the 48 in the country and one of the few in the region, but most importantly, that level of care will become available right here in Prince George's County. Number 3, our neurodegenerative program. This also will become available right here. What does that mean? It means a host of very debilitating, disabling diseases, such as Alzheimer's or dementia, autism, movement disorders or Parkinson's, and unfortunately, the very bad disease, some refer to as Lou Gehrig's disease or amyotrophic lateral sclerosis or ALS, that too will be part of our offerings, which will be right here in Prince George's County, available to residents in the region. And finally, as another example, our trauma and critical care medicine. This will be managed by the same medical and surgical experts who currently lead the University of Maryland, R. Adam Cowley Shock Trauma Program. As you know, this is a program that is worldwide and considered to be the worldwide leader in trauma and critical care. Such care and such services will also be available right here in this county. So, as Brad says, as I attempt to close, bolstered by the power of partnership that I mentioned earlier, we will work collaboratively. Collaboratively with leadership, Bob Krenzik and his team from the medical system, and my team from the medical school will work tirelessly to improve the health status in this region virtually through the programs I mentioned and through many others. We're very excited about this day. We believe this planned state-of-the-art facility at Capital Region Medical Center is critical to our enterprise. But most importantly, it is an incredible asset for the citizens of Prince George's County. So as I began by saying, it has been a long, very long pregnancy, but it's a wonderful birth that we all can celebrate. Thank you very much.
For decades, the citizens of Prince George's County, Southern Maryland, and the region have not had the level of high-quality patient care that they deserved. And I spent the greater part of my life here in Prince George's County, nearly 50 years, just down the road, grew up in Landover, moved to Capitol Heights, and then eventually right out here to Largo, where we're standing. And I'm proud to have been a strong supporter of this project since day one. Despite some, let's say, spirited negotiations, I am pleased that we are finally able to get this vital project underway. We are committing more than $200 million towards this new state-of-the-art facility, which will transform healthcare in Prince George's County and across the Capital Region. Pushing to get this hospital built has been a mission that is very personal to me. During my battle with cancer, I came to understand and appreciate the work of our state's great health and research facilities in ways that I could have never imagined. As an extended stay University of Maryland system patient, and I can tell you firsthand that there's no better place in the world to receive high-quality medical care than right here in the state of Maryland. And now, with this much-needed project in partnership with UMS, more than 1 million people in Prince George's County and Southern Maryland will finally get the hospital that they deserve, and they will have access to some of the best doctors and nurses and healthcare professionals in the entire world.
Yes, we are building a building today, but that is not what we're doing. What we are doing is giving hope to those who come in there and who don't know the people that they are trusting their loved one to. That the first person they meet may not be a doctor or a nurse. It may be the person who's a security guard right at the front desk at a time when they need you just to let them in. No, we're not building a building. What we are providing is that level of comfort and hope to people we don't know and may not thank us on their way out, but they're thankful we are there. Every morning, I would visit my wife, as people in that place will tell you. Some mornings I was happy. Most mornings I wasn't. I stayed late, slept in chairs, snuck in when I wasn't supposed to, sorry. And then I went to work. And I close with this. I went to work every day not because I didn't have a choice, because I did. I could call in. I went to work every day because I wanted to remember what it was like when I walked in. I wanted to remember that there are individuals who leave their loved ones with us who don't have that choice. I wanted to remember that, and I want us to remember it when we hire every single person that goes into this facility. I wanted to remember because every time I think about healthcare in a way, I should think about it from people who don't have that choice and who don't know anyone and who can't say, please, get me the best surgeon. This is for them. God bless you.